Liver disease can be divided into 3 stages. The first stage is fatty liver, the second stage is liver fibrosis, and the final stage is liver cirrhosis. The causes of liver disease can be divided into metabolic dysfunction associated liver disease, alcohol associated liver disease, metabolic dysfunction alcohol associated liver disease, specific etiology liver disease. This new nomenclature from last year reflects the fact that metabolic syndrome is on the rise and that there is an interaction between alcohol and metabolic syndrome to cause liver disease. So what are some symptoms and signs of liver disease? Symptoms could be right upper quadrant pain, fatigue, itching, yellow eyes, swelling of the extremities, a swollen abdomen, and easy bruising. Signs can be palmar edema, Dupuytren's contracture, jaundice, spider nevi, bruises, ascites, caput medusae, gynecomastia, and loss of pubic hair in men. Decompensation of liver disease happens when you have liver cirrhosis. So even if previous scans or ultrasounds don't show liver cirrhosis, if you've clinically got decompensation of your liver, you're in liver cirrhosis. There are the 3 A's: asterexis, liver flap; ascites, distended abdomen with shifting dullness; and altered consciousness, hepatoencephalopathy. Now, in decompensated liver cirrhosis, any of the liver blood tests can be deranged. One of them or all of them. Platelets, INR, albumin, bilirubin, ALP, ALT, any of them could be deranged. Most commonly, however, we see that the INR and the bilirubin is high. Some specific tests to look for decompensation of the liver is an ultrasound with portal Dopplers to check for ascites or portal vein thrombosis, an EEG which may show hepatoencephalopathy, or the ammonia level which is raised in liver cirrhosis. So what causes decompensation of liver cirrhosis? Virtually anything that makes the body unhappy can. Infection, metabolic disturbance, constipations, bleed, anything. So how do you treat decompensation? You treat the underlying cause, you drain any ascites there is, you give strict bowel care with lactulose to make sure your ammonia levels don't build up. What are complications of liver cirrhosis? Spontaneous bacterial peritonitis if ascites get infected, variceal hemorrhage which can lead to a massive upper GI bleed, or hepatorenal syndrome which has a very poor prognosis. Remember, importantly, just because the previous ultrasound or CT does not show liver cirrhosis does not mean the patient doesn't have it. Consider intensive care or HDU if you've got liver failure with hepatoencephalopathy or hepatorenal syndrome. Remember, the liver and the brain are organs too. The aim is to try to treat patients before they get to the liver cirrhosis, because once the patients get to liver cirrhosis, it is a ticking time bomb. Hope you enjoyed this talk, a lot to take in, but practice, and don't forget to subscribe.